Niacin, the overlooked vitamin for eye and nerve health. Did you know a simple vitamin can boost your blood flow to your eyes, protect your retina from damage? Let's talk about niacin. Niacin or vitamin B3 is an essential nutrient that helps converting food into energy. It supports DNA repair, cholesterol balance, improves microcirculation, especially to the eyes and the brain. On eye health, the benefits in retinitis pigmentosa, it helps improve retinal metabolism and blood flow, supports mitochondrial function and mitochondrial stimulation, reduces oxidative stress on the photoreceptors, thereby damage being prevented, inflammation being reduced. It works synergistically with CoQ10 and NAD plus boosters. These are supplements which we give. Macular degeneration is another area where niacin may protect retinal pigment epithelial cells from oxidative damage. Maintains healthy choroidal circulation, which is crucial for the macula. Early studies suggest a role in reducing drusen formation as well. In diabetic retinopathy, it improves microvascular function and reduces inflammation. May help regulate lipid and glucose metabolism, protecting retinal capillaries. Acts as a vasodilator, improving oxygen supply to the ischemic retinal areas. Other systemic benefits are it boosts HDL, good cholesterol, and reduces the LDL, like the rice bran oil which does. It improves energy metabolism via NAD/NADH pathways, supports brain and nerve health, helping in depression and cognitive decline patients. It detoxifies the liver and supports skin health. The dosage, how much do you take for nutritional support? People who don't have any issues, 50 to 100 milligram per day is good enough. But if it's a therapeutic dose, please take it under medical guidance by a doctor. It could be anywhere between 250 to 500 milligrams per day. Always start low and increase gradually. Prefer niacinamide or nicotinamide riboside. They are flush-free forms if you're sensitive. So, what are the side effects? Niacin flush, it causes redness, tingling sensation, warmth on the face and neck. These are all temporary. Liver strains, if taken in very high doses, liver could have some toxicity. Gastritis or stomach upset could be there if you take on larger doses. Rarely may cause increased uric acid or worsen the gout. So it is contraindicated in certain people. Always to be avoided in people who have liver problems, elevated liver enzymes. In acid peptic disease, in severe diabetic patients may affect the glucose levels, and in gout or uricemia patients to be avoided. So what all can it be combined with? Combine niacin with CoQ10, omega-3, lutein, zeaxanthin, and NAC, N-acetylcysteine for powerful retinal vascular support. And pair it with yogic breathing, photobiomodulation, which we have for even better oxygenation of the retina. Hence, niacin is just not a vitamin. It's a fuel for your retina and the nerves. If you have RP, macular degeneration, or diabetic retinopathy, discuss with your doctor or call us to know more about it and this therapy, what it's all about. Thank you, Dr. Sashi from Sashi Eye Care.